I'd like to introduce our first witness, Dr. Blumenthal. Welcome. Dr. David Blumenthal is the National Director for Health IT in the U.S. Department of Health and Human Services. As the National Coordinator, Dr. Blumenthal leads the implementation of a nationwide health information technology infrastructure. HHS is the government's principal agency for protecting the health of all Americans and providing essential human services. We look forward to your testimony.
Thank you, Madam Chairwoman. Madam Chairwoman, Ranking Member Westmoreland, members of the subcommittee, I'm David Blumenthal. I'm the National Coordinator for Health Information Technology in the Department of Health and Human Services, and I'm very pleased to testify before you today on the administration's health information technology activities, and specifically how they impact small healthcare practices. Health information technology, or HIT, allows comprehensive management of medical information and its secure exchange between healthcare consumers and providers. Broad use of HIT has the potential to improve healthcare quality, to reduce unnecessary healthcare costs, and to improve population health. The American Recovery and Reinvestment Act of 2009 included the Health Information Technology for Economic and Clinical Health Act, or HITECH Act. The HITECH Act includes $2 billion in funding to the Office of the National Coordinator to lay the groundwork for adoption and meaningful use of HIT through infrastructure programs. It also includes an estimated $44.7 billion in incentive payments from Medicare and Medicaid to providers who are meaningful users of certified electronic health record technology. Many physicians in small practices want to adopt HIT, but do not have the ability to invest upwards of $40,000 in the technology systems. By providing physicians and other healthcare providers with financial assistance for adoption and use of interoperable HIT, we will help reduce this burden. Physicians, including those in solo or small practices, can receive up to $44,000 under Medicare in incentive payments for being meaningful users of certified electronic health records. The HITECH Act includes grant programs as well as education and technical assistance opportunities to help providers, especially those in small practices, to overcome barriers to adoption. Meaningful users will become eligible for incentive bonuses in 2011. Beginning in 2015, the Recovery Act authorizes penalties under Medicare for eligible professionals and hospitals that fail to demonstrate meaningful use of certified electronic health records. The qualification criteria for incentives are still in development and will be defined through regulation. The HIT Policy Committee, which is a federal advisory committee that provides recommendations to the National Coordinator, met on June 16, 2009 to discuss proposed objectives and measures of meaningful use. This discussion focused on a vision for healthcare that outlined a progression from process measures in 2011 to outcome measures in 2015 for improved population health. ONC and CMS are hosting listening sessions targeted at small healthcare practices so that HHS is informed of their questions and unique concerns as HITECH is implemented. The decision on the definition of meaningful use is a key step toward transforming our healthcare system. In addition to the incentive payments, the HITECH Act authorizes grant programs that ONC can implement to help providers and communities adopt and become meaningful users of electronic health records. Two of these grant programs include regional extension centers and state grants to promote health information exchange, or HIE. Currently, 21% of physicians have adopted an EHR. The adoption rate among small healthcare practices is significantly lower at about 13%. This discrepancy in the rate of adoption for the nation and for small practices highlights the need for focused technical assistance for small healthcare practices. The HITECH Act authorizes an HIT extension program to make assistance and education available to all providers, but with priority given to select providers, including individual or small practices and small group practices that are focused primarily on primary care. HHS is actively working to get programs planned and implemented this year to support hospitals and eligible providers in becoming meaningful users of EHRs. The HITECH Act provisions of the Recovery Act create an historic opportunity to improve the health of Americans and the performance of the nation's health system through an unprecedented investment in HIT. This initiative will be an important part of health reform as professionals and healthcare institutions, both public and private, will be enabled to harness the full potential of digital technology to prevent and treat illness, improve health, and increase the efficiency of our healthcare system. Madam Chairwoman, thank you for the opportunity to appear before you today. I'd be glad to answer any questions.